Oh, hi there! Magandang Jensen! It's me, your teacher, Mimik. So today, we're going to have lots of fun and learning. So are you ready? Everybody!
If you want to explore all about science, come and join. Let us all learn. The science is fun. Science is cool. Watch and learn. The science is fun.
Now, after this episode, we shall be expected to infer how one's lifestyle can affect the functioning of the respiratory and the circulatory systems. Specifically, we shall understand the different diseases affecting the respiratory and the circulatory systems due to unhealthy lifestyle. So let's have an activity first. Since we are experiencing new normal nowadays due to COVID-19 pandemic, we are asked to stay at home in order to prevent the spread of the coronavirus. And we are doing this for almost 6 months already. Our activity has something to do with our daily activities. I will mention some routine or activities or practices done at home, and all you need to do is put a check mark if you are doing it, and then put an X mark if you are not doing it. First, make sure you have your pen, your notebook, and your self-learning module. So are you all ready? Now let's start. Number 1. Do you regularly exercise? Number 2. Fond of eating chips, candies, french fries, and the likes? Number 3. Fond of spending too many hours playing cell phone? Number 4. Sleeps 2 to 3 hours at night? Number 5. Loves spending too many hours in watching television every day? Number 6. Cigarette smoking? Number 7. Burning plastics or rubber materials? Number 8. Fond of eating meat instead of vegetables? Number 9. Fond of drinking soda such as cola? Number 10. Spends too much time in playing ML and online games every day. Okay, stop writing. Let's evaluate your daily routine. When you are able to write 2 check marks, it means that you are practicing healthy lifestyle. Congratulations! Then when you are able to write more than 3 check marks, it means you are practicing unhealthy lifestyle. Then you have to explore more about the effects of unhealthy lifestyle to our body. Lifestyle is the way in which a person lives. People doing daily exercise, eat fruits and vegetables and a balanced diet of meat, sleeps 6 to 8 hours at night, avoiding cigarette smoking, are people doing healthy lifestyle. Now on the other hand, people who have vices love eating foods that taste great but do not offer any nutritional value, such as potato chips, candies, and the likes, are people who practice unhealthy lifestyle. Yes, indeed, it is important to know the kind of lifestyle we are practicing. For your information, the leading cause of death around the world are diseases affecting the respiratory and circulatory systems. However, they can be prevented simply by having a lifestyle that promotes wellness. The circulatory and respiratory diseases begin to develop with unhealthy lifestyle. So, we are ready to explore more all about it. As I mentioned a while ago, several lifestyle choices can affect a person's risk of developing respiratory and circulatory diseases. One of those is called emphysema. So what is emphysema? It is a lung condition that causes shortness of breath. Emphysema and chronic bronchitis are two conditions that make up chronic obstructive pulmonary disease, or what we all call as the COPD. Cigarette smoking is the leading cause of COPD, as well as marijuana smoke, air pollution, and chemical fumes, and also dust. A person with emphysema could be treated using prescribed medication and supportive therapy that includes oxygen and smoking cessation therapy. Second is the atherosclerosis and arteriosclerosis. Atherosclerosis happens when the plaque collects and causes arteries to narrow and harden due to factors such as smoking, high blood pressure, and cholesterol in the blood. The difference between atherosclerosis and arteriosclerosis is that atherosclerosis refers to build of fats, cholesterol, and other substances that triggers the blood to clot, while the arteriosclerosis occurs when the blood vessels that carry the oxygen and nutrients from the heart and to the rest of the body thickens and hardens. A person with atherosclerosis and arteriosclerosis is advised to undergo medication and surgical procedure and to change lifestyle. Third is the coronary heart disease. The coronary heart disease develops when the major blood vessels that supply our heart with blood, oxygen, and nutrients become damaged. This disease can be caused by high cholesterol foods, diabetes, family history, and smoking. Coronary heart disease is commonly treated with a combination of change in lifestyle, prescribed medication, and in some cases, through surgery. Fourth is bronchitis. A bronchitis is an inflammation of the mucous membrane that lines the bronchial tubes. The thick mucus builds up, causing coughing, difficulty of breathing, and a heavy feeling in the chest. So what causes bronchitis? Bronchitis may be caused by bacteria, viruses, or irritants in the air. There are no cure for chronic bronchitis, but there are several medications to help relieve symptoms. It is also important to avoid smoking and smoky environments, and to drink lots of water and get plenty of rest. Pneumonia is the fourth respiratory disease. Pneumonia is an infection in one or both lungs which causes inflammation of the air sacs. The infection is caused by bacteria, viruses, and fungi. treatments for pneumonia involves curing the infection and preventing complications. People who have community-acquired pneumonia usually can be treated at home with medications such as antibiotics and pain reliever, recommended of course by the doctor. Next is asthma. So, asthma is a chronic respiratory disorder caused by inflammation and narrowing of the bronchial tubes. And asthma is triggered by airborne substances, certain foods, common bacteria, and viruses. Inhalers and nebulizers are the key components of asthma treatment. Lastly, tuberculosis. Tuberculosis is a disease caused by the bacteria called Mycobacterium tuberculosis. The bacteria that causes the tuberculosis are spread from one person to another person through tiny droplets released into the air via coughs and sneezes. With early detection and appropriate antibiotics, TB is treatable. Treatment for TB can vary. It may involve taking an antibiotic once a week for 12 weeks or every day for 9 months. Those are just some of the diseases that could affect the functioning of the circulatory and the respiratory system. Some are hereditary and mostly are because of unhealthy lifestyle. How can we prevent such disease? Well, of course, quit or stop smoking, eating healthy food, exercise regularly, maintain healthy weight, and have enough rest or sleep, and taking vitamin C to boost immune system are ways to help prevent diseases related to circulatory and respiratory diseases. Great! Now you know that lifestyle can affect the respiratory and circulatory systems. Thus, it is important to know the ways to live a healthy lifestyle so that the rest of the respiratory and the circulatory systems could function well. Now we are done. Earlier, we discussed how lifestyle affects the functioning of respiratory and circulatory systems. Remember to read your notes again and see what we learned. To better understand our lesson, read the reading resources provided in your modules. Always remember to have fun in learning and keep safe always by staying at home. Always wash your hands and stay healthy. Let's beat COVID-19 together. This is Teacher Mikmik. Keep focused and study hard. Have a nice day, everyone.